Hi everyone, this is Dr. Guan here. Today I'm going to talk about how to check your blood pressure at home. First of all, let's talk about what is normal blood pressure. So blood pressure is made up by two parts, systolic pressure and a diastolic pressure. More commonly, we refer to the top number and the bottom number. So here's a table from American Heart Association. I really recommend everybody should have a copy for reference. As you can see from the table, normal blood pressure is when your upper number is less than 120 and the bottom number is less than 80. If your blood pressure range in 120 to 129 in the upper number and the bottom number is less than 80, then you have elevated blood pressure. If your upper number is 130 to 139 and the bottom number is 80 to 89, then you have stage 1 high blood pressure. If your upper number is 140 and higher, or the bottom number is 90 or higher, then you have stage 2 hypertension. If your upper number is greater than 180 and or the bottom number is higher than 120, this is really a hypertensive crisis. You should contact your doctor to make an appointment immediately. If you have chest pain, shortness of breath, headaches, lightheadedness, weakness, blurry vision, slurred speech, then you should proceed to the nearest emergency room because the risk of having heart attack and stroke is very high in this range. So if your blood pressure is above 120/80, you should be checking your blood pressure regularly. If you are already taking blood pressure medications, then you should be checking your blood pressure at least 3 to 4 times per week, if not daily. So I really recommend you should get a blood pressure monitor at home so you can check very frequently. There are a lot of blood pressure monitors on the market. There are manual ones, there are automatic ones, there are ones that measure from your arm, and there are ones that measure from your wrist, and they also have one monitor from your fingers, and also you can wear them on your wrist as a watch. So I typically recommend my patient to get a automatic blood pressure kit that measure from your arm because I feel that's more accurate than the one on the wrist. However, if you already have a wrist one, that's fine too. Just knowing that the wrist blood pressure monitor is it may give you a little bit higher reading than the one from the arm. Also, some patients may have severe arthritis, so just taking off the Velcro can be very painful for them. So if that's your case, then a wrist one is completely fine. Just please make sure that you bring your monitor, whether it's wrist one or arm one, to your doctor's office with you. It's very good to compare your numbers or your readings compared to the readings that you get from your doctor's office. So there are a lot of different monitors, like as I say, and they have different price for those monitors, and someone may say, how much should I spend on one of those monitors? So I think really the more expensive one, yes, they do have a lot of functions, such as they can store a large amount of readings, data for you, and they can also generate maybe a table or a graph for you to visualize how your blood pressure is progressing. Some of them can even accumulate data and connect to your smartphone and then send an email to your physicians. But honestly, I think all you need to have is just a basic monitor, and make sure you have a large enough screen that you can read the number very easily and it's bright enough that you can see. Then you just need to get a small calendar book or small notebook, write it down every time you check your blood pressure, and take that with you when you go to your doctor's office. I feel personally that's a lot easier for me to communicate with my patients when they bring that little booklet, so I can see how often they're doing it and I can see what their readings are, and sometimes I just make changes on their calendar. If I increase their dosage to twice a day or increase to a higher number of dosage, then I'll just write it on their book. So I think especially in the older population, patients really like that because it's much easier for patients to remember that. If you have hypertension and you're taking medication for your blood pressure, you can ask your doctor to write a prescription for a blood pressure monitor. Sometimes your insurance will pay for part of it or all of it, so that might save you some money. Now let me show you what I use to check blood pressure at home. So I have three types of monitors. One is the automatic one. I got this from CVS a few years ago, probably about $30 there or on sale. Very easy to use, and this is what I recommend for patients to use at home. You can do this easily by yourself. And here's another one. This is what you normally see at doctor's office. It requires a stethoscope, and also you have this traditional bulb and a cuff type of thing. It's very accurate, but it does take some training. Now the third type, which I don't know how many people are still using this, but is given to me by my grandfather. This is a mercury blood pressure monitor kit. So you can see when I pump some air into the cup, and the little mercury will go up to the column. So because mercury is dangerous for the environment and poisonous, so not too many people use this anymore. But it's very meaningful to me, so I still use this at home. Now let me show you how to use this automatic blood pressure monitor. So first of all, when you get a monitor, you want to make sure you find the right cuff size. Now the cuff size is pretty standardized. This one I got from CVS a few years ago for probably about $30. It was on sale. So right here it says it fits arm that's 9 to 17 inches. If your arm is very small, you can probably find a smaller cuff size, but typically I think 9 inches is pretty good. If your arm is larger than the cuff size, then you can ask the pharmacist to direct you to a even larger cuff size. Just make sure you find the appropriate size, because that's very important to get an accurate reading. So now next, you want to make sure you need to know which size you want to check, left arm or right arm. Typically it doesn't really matter, but if you have had history of blood clots in your arm, if you had AV shunt for dialysis, if you had a lymphedema or swelling of your arm due to history of breast cancer, if you had a lymph node resected in your armpit region, then don't use that arm, use the other one, okay? But for pretty much most of everybody, we can use either left or right. So let me just show you. This is quite easy to use. So you just put your arm through this cuff, and make sure you have very thin layer of clothing, because you really don't want your clothes to bunch up all the way to the top, because that's actually going to affect your blood pressure readings. I have a very thin layer, so this is okay, but if I have a sweatshirt or a jacket, I would definitely take that off. It's best to put cuff on the bare skin, okay? But sometimes it can be too cold, so you can wear a very thin layer. The other thing is, make sure your elbow is very well supported. You can put on the table, and just make sure your elbow is at the same level or near the level of your heart. And you can see my elbow creases right here and my heart's right here. So, and make sure this tube is going away from you, right? You don't want the tube to go the other side. Okay, where you want to put the cuff, and you should check, okay, here's your elbow crease, and you want to place probably about 2 centimeters above your elbow crease right here. So probably about 2 finger width, and then you just pull it. Okay. Okay, and just make sure the fitting is right. You should fit 2 fingers underneath the cuff. Okay, if it's too loose, you will have a false lower number, a lower blood pressure reading. If it's too tight, then you're gonna give yourself a false elevated number. Okay, so, and the next thing you should do is make sure you sit there quietly for 3 to 5 minutes. If you just went to exercise, and if you just had a cup of coffee, and if you just smoke, which you should not be smoking, or you just ate dinner, then you should wait probably 30 minutes before you check blood pressure, because it's going to affect your readings. Okay, so here, very easy. You just hit the button, and you should not talk when you check your blood pressure, but I have to talk because I'm making a video. So my blood pressure is 98/69. My heart rate is 65. And you may think this blood pressure is low, but low blood pressure is okay as long as you don't have any clinical symptoms, meaning that you don't feel lightheaded, you don't feel shortness of breath with activity. I can exercise with this blood pressure, and I don't have problem with anything. So this is pretty normal for me. By the way, I forgot to mention earlier that when you check your blood pressure, you need to make sure your feet are on the ground. Okay, don't cross your leg because that's going to affect your blood pressure as well. So next you should do is give a minute and repeat your blood pressure one more time. If your readings are very similar to the first one that you got, then just get an average and then write down on your calendar or your notebook. If the number is slightly higher, the second one, or lower than the first one, you can take the third time and take an average. Now, I do recommend my patient to check their blood pressure around the same time every day. You can check twice a day or you can check 3 times a day, but typically I want them to do it morning or in the evening or the noon time, because our blood pressure does fluctuate throughout the day, so I think it's good to check around the same time. You're probably wondering when you should start blood pressure medications. Well, that all depends on your risk factors for heart attack and stroke. So there's a very great website, you can check it out, and they will tell you your risk factors in the next 10 years for heart attack and stroke by plugging your blood pressure, your age, your gender, and whether you have a history of diabetes, if you're a smoker or not. You also need to have your cholesterol numbers handy to plug in all the data. So if you have a risk factor that's greater than 10%, then it's probably better for you to start medication to control your blood pressure. Okay, that's it for this week. Thank you for watching my video. I hope you find the information helpful. Please like, subscribe, and comment down below, and I will see you guys next week.